Well, good morning once again. I want to begin by thanking you for attending today. We had over 500 agents register for this conference, and I want to thank each of you for taking time out of your day. We're going to start shortly. Expect to start in just about 1 minute, so bear with me for just a second, and we'll be right back. So again, thank you for attending today. As I look at the list of people who are on the line, one of the things I see is a lot of people unfamiliar. And so I want to take just a minute to explain to you a little bit about who we are and why we do these conferences so you understand that we're not trying to sell PPACA support here at Insurance Network. We are an independent managing general agency, and we've been doing business for 25 years. Our job is to provide product for independent insurance agents for their clients. We do that on the employee benefits side. We also do that on the life and annuity side. So again, the reason that we do these conferences and these webinars is to provide the service to the agents that write business with us. But also we understand that we want to make them available for anyone willing to join in and hang out with us for an hour. Why would we do that? Well, the answer is simple. We know you need the help, and we don't mind helping. All that we ask is that you consider giving us a chance to earn your business. So let's get started. You know, if you've attended webinars or meetings I've hosted in the past, that I can't start a PPACA webinar without reminding all of you what it is that we're facing and why it is such a daunting task for all of us to keep up with it, let alone stay ahead of it. I don't think anything demonstrates that better than this graphic. The truth is that some of this has changed since then. Not a lot, but some. I still think the point is made. Hundreds of new and expanded government regulations and agencies were part of PPACA, which might also explain why we're still learning what's in it. The problem is that, like it or not, it's here. It's not coming, it's here. And the average employer has no idea exactly how this is going to impact his business. We know they're turning to you for help. That's why we've worked so hard to provide this to you, not only in these webinars, but in our annual producer training meetings and our individual discussions with our producers. I will tell you this, it's hard to stay on top of, and it's even harder to present it to you so that it all makes good sense. I promise to do my best today. Today is our second in a three-part series, and we'll focus primarily on PPACA and the small employer. We're going to talk today about group size, the difference in PPACA in how it impacts the small and large employer is substantial. We want to show you how to tell the difference between the two, and some of it may surprise you. We want to talk about whether or not your clients can keep their current plans and what they'll be able to buy in the marketplace in 2014. We're going to talk about premiums. What can your clients expect and why? And I wish that that were good news, but unfortunately I think we've got some very, very difficult conversations with clients ahead. And then we're going to talk about some recommended strategies, some tools we've developed, and also some ways that we recommend that you and your clients navigate these new challenges. In 2 weeks, we're going to host our final session of the series, where we're going to focus on impact to employers who are subject to the employer mandates. But for now, again, today's is going to primarily focus on the small employer. So let's talk about that just a little bit. One of the things I want to point out is it's no wonder it all gets so confusing. Look at something as simple as small versus large employer. In PPACA, they address this in two different areas, and interestingly, with two different definitions. When it relates to the exchanges, the small group market is actually defined as 1 to 100 full-time equivalent employees. Now, each state may choose to limit access to 1 to 50 in 2014 and 2015, but in 2016, the small employer market will be defined completely as 1 to 100, and all of those employer groups must be able to purchase plans inside the exchanges. Interestingly, however, under the employer responsibility provision under PPACA, a large employer is defined as one with 50 or more full-time equivalent employees. So you see right off the bat we have some contradictions. Then when we take a look at the definition of a full-time employee, that also creates some different challenges. You'll hear a lot of talk in PPACA, sorry about that, PPACA, about a full-time equivalent. A full-time equivalent employee is actually one or more employees whose hours, when totaled together, equal 2,080 a year, which is the equivalent of 40 hours a week. However, there's also a definition in the reg about a full-time employee, and this really has more to do with who you must cover. A full-time employee, in other words, if you're subject to the mandate, you must cover all full-time employees, and that would be an employee who works an average work week of 30 hours or more. So again, you've got to pay close attention to the language anytime you're referring to the law, because you will sometimes hear them refer to a full-time employee, other times a full-time equivalent, also commonly known as an FTE, and it's important that you pay close attention to which one they're referencing, because as you can see, they are different in their definitions. Now, when it comes to counting those full-time equivalents, one thing you've got to understand before you count the hours is which hours do you count? For hourly employees, you count the actual paid hours. Keep in mind, paid hours include actual hours worked, paid vacation, paid personal leave, paid holidays, and even military duty. So that can be a little bit tricky. For all other employees, such as salary, there are 3 different methods that exist. But if you spend a lot of time looking at them, I will assure you that the easiest thing, the safest thing to do would be to count each of those as a full-time equivalent without doing any additional math. So which employees can you exclude? If you're going to count up all the hours to determine how many full-time equivalents you have, well, you don't count independent contractors, sole proprietors, partners in a partnership, 2% shareholders in an S-corp, leased employees, overseas employees, but you must count foreign workers in U.S. operations. In other words, if they're a W-2 employee working inside your business here on U.S. soil, you've got to count them. Now, a couple of things I want to point out to you. When talking about independent contractors, we're really talking about 1099 employees. And I want to warn you that the IRS is already talking about coming down on and sanctioning employers who are thinking about changing the status of employees from W-2 to 1099 in order to get around counting them. It won't work, and expect to see this continue to be closely scrutinized. Another thing I want to talk about briefly here is you may not exclude temporary employees from the count. Now, you may be able to exclude them from the mandate to offer coverage, but that's something we'll address in the next webinar. What the law states is this. This is kind of tricky, so I'm going to say this a little bit slowly because it doesn't make a lot of sense unless you pay close attention. If an employer's workforce exceeds 50 full-time employees, 50 full-time equivalents, for 120 days or fewer, and the employees in excess of that 50 who were employed during that period of no more than 120 days were seasonal employees, the employer would not be considered to be a large employer. So when you're looking at employer groups who have a very, very limited season, maybe a golf course in a cold climate, or a ski resort, or a Christmas tree selling operation, as long as the employees that they have that exceed 50 during that 120-day period of time or less are those seasonal employees, then you could exclude them from the count. If you have a group that has extremely high turnover and most of their employees don't work longer than 4 months, doesn't matter. You've still got to add all of their hours up together to see whether or not they equal 1 FTE. Another caution, you hear a lot about this, for controlled groups. For purposes of determining applicability of PPACA, a controlled group is considered to be one employer under the law. So if you have an owner with 4 unrelated businesses, each with 15 full-time equivalents, you may very well have an employer that is subject to the mandate. Again, this is one of those subjects we'll cover in depth in our next webinar, but I wanted to point that out to you, that just because you have 4 little groups, if you've got some common ownership, you may actually have a large employer under the law. So now that we've talked about who to count and what hours to count, let's look at the actual math. Remember that before we talked about a full-time equivalent being any one or more employees whose hours total 40 hours a week. 40 hours a week equals 2,080 per year. So again, the number of employers' full-time equivalents is determined by dividing the total hours for which an employer pays wages to all employees during the year by 280. However, if you have an employee who exceeds that, you have an employee who is working, long hours, 60 hours a week, whatever the case may be under salary, you cap their number at 2,080. Hope that makes sense. So again, 2,080 per employee up to 280, total hours you paid divided by 280. And I'm going to show you in a minute how that works in a real example. A couple other things to know. If the result is not a whole number, then it's rounded down to the lowest whole number. So if your math results in 17.8, you have an employer with 17 FTEs. Now, I know that can be confusing, so I'm going to just walk you through some math, and I'm going to try to make the math make sense on a weekly basis, because I think that's easier for an employer to think about. Let's look at this example where we have a 70-life group. 30 employees, each working 40 hours a week, and 40 employees working 10 hours a week. If we do the math, we have 30 times 40 is 1,200, 40 times 10 is 400, a total payroll of 1,600 hours per week. Multiply that by the number of weeks in a year, we have 83,200. Divide that by 2,080, and we have 40 full-time equivalent employees. This group, even though they have 70 employees, would not be subject to the mandate. This group would be considered, for purposes of employer responsibility provisions under PPACA, a small employer. Leave that up for just a second and let you take a look at it. See if that makes sense. Now again, the way the red reads is you have to do this on an annual basis, but if I were sitting down with an employer tomorrow, I would walk them through it on a weekly basis because I think it makes more sense. You should know that the testing period for 2014 will be a period of time in 2013, and there are some different testing periods that you can choose, and we'll talk about that in the next section because it really has to do with those employers subject to the penalty. But I did want to point out, and hopefully this makes sense. I also want to point out now it's probably a good time. If you do have questions, you can type them in on your screen. Over on the right-hand side of your screen, you should have the opportunity to enter a question in. And at the end of this, we're going to try to get to as many questions as we can. If we can't get to them, we've got staff that are going to reach out to you following the session. So let's take a look at this group. Now you're a small employer. So what? Should you be concerned at all about PPACA for those groups? After all, there's no mandate to offer coverage. Well, the truth is that these employers are going to be significantly impacted by PPACA if they choose to offer coverage, and we expect that many will. So let's talk about the impact of the small employer. Beginning in 2014, if they do offer coverage, they may not impose a waiting period longer than 90 days. This is an area of the law we're watching for clarification on, because the law specifically says no longer than 90 days before they must come on the plan. Well, what does that mean? Those of us in the business know that typically that would be a 90-day wait and then the first of the following month following the waiting period. But that's not what the law says. So there's a chance that this may mean if you've got a plan that only offers first of the month enrollment, that really you're talking about a waiting period no longer than 60 days. Now, this is going to impact non-grandfathered groups in 2014 as they renew, so just keep that in mind. New rule as well, subject to new non-discrimination rules, even if the plan is fully insured. This was a change with PPACA. I'm going to talk about an example of this later. This is something that is currently on hold but could be coming back any minute because it is part of the law. Additionally, a small employer group must offer a plan that meets minimum standards. And rates are going to be significantly different than they are today. When we talk about benefit mandates and changes, let's talk first about some of the things that have already happened on non-grandfathered plans. We know that we no longer can have lifetime limits or annual limits on essential health benefits. Pre-existing condition clauses were removed for children under the age of 19, and we have the so-called quote-unquote free list of preventive services, those that the insured may not have to pay copay, cost sharing, or be subject to a waiting period. They must have 100% coverage for about a 4-page list of preventive care services. Now, if you attended the meeting last month, you know that we do now know what those benefits are considered to be essential. These are the benefits that can have no annual or lifetime limit on them. Although some plans have been allowed to phase these in over 3 years, these are the ones that we now have to watch out for. Now, a couple of things about these. First, most of these have always been covered same as any other illness. Some of them that are going to impact your rates are mental health, substance abuse, and to a certain degree rehabilitation services, because on small group we haven't had to have mental health parity. On small group we haven't had to have unlimited resources for substance abuse. And certainly there have been some limits on physical therapy and rehabilitation services. All of those go away. Another big one on this screen that people are still trying to explore is the fact that your health plan is now going to have to cover dental and vision for children. And we're waiting for some additional clarification on that. These things are going to make rates go up. There's no other way around it. More significant to most plans is the restriction on plan designs. Inside the exchanges, you can expect the following plan changes or plan limits, plan restrictions, however you want to look at it, to be imposed. Starting in 2014, deductibles may not exceed $2,000 for an individual or $4,000 for a family. And the total out-of-pocket on the plan, including in-network deductibles and co-pays, may not exceed the annual out-of-pocket allowable under a health savings account. So in 2013, we know what those amounts are. They're $6,250 for an individual, $12,500 for a family. It's important to note that the out-of-pocket for purpose of this restriction does not include out-of-network cost sharing, so balance billing. It also doesn't include premiums paid or services not covered under the plan. There is an exception. Any person under the age of 30 may be offered what's called a TIN plan, and we'll talk about the metal plans in a minute. But a TIN plan can have a higher deductible or out-of-pocket. These plans may also be offered to people who would otherwise be forced to purchase what is going to be called unaffordable coverage. Additional changes coming up in 2014 are huge. Perhaps some of the biggest changes to the small group market is this: no pre-X and guaranteed issue for all applicants starting in January of 2014. If you have a plan currently on the books renewing 2014, and you have somebody who has a pre-existing condition, maybe they come on with no coverage in December of this year, when that plan renews in 2014, pre-existing condition exclusions will have to be removed for that individual. Now, there's a lot of discussion about some of this, which relates to an annual open enrollment. There is a lot of discussion to add what's called a special enrollee provision. That would be something similar to what you currently see on small group in, the HIPAA requirements, where you have a special enrollee period, and that's the only time that you can enroll without any waiting period. Hopefully, something like that will come down, and I do expect to see that. There's been some back and forth discussion. We saw a comment period come out by HHS where they said that they understood the need for it. They were going to give the states the ability to impose these annual open enrollment with special enrollment provisions. Then we saw something else come out by the administration that said, wait a minute, hold up, that holds back for the intent of the law, which was everybody would have open access to health insurance. The challenge is, I do believe the industry understands that you can't have people buy insurance on the way to get their procedure, which if you take the law in its very strictest sense, that's absolutely what could happen. So we'll keep an eye on all of that. Now, as we talk about premium impact, we have to talk about the new taxes and fees that will most certainly be passed on to the insured in the form of premium increases. Now, this is a busy slide, and I'm going to just highlight it for you briefly. And if you want more details, we've got a great piece that we could provide to you that walks you through the new fees. One of our carrier partners put together one, and if you just make a note of it, and I'll remind you on the last slide too, it's called the Overview of the 4 Fees, and it covers several of these on here. But you've got the PPACA and SURF fee. You've got the health insurance tax, which quite a few people are trying to get repealed right now. I don't think it's going to happen. It is a huge part of how they're going to fund PPACA. And the thing with this that not everybody understands is not only is it going to be on all insured plans, including medical, dental, and vision plans, it's also going to be imposed on all Medicare Advantage plans and Medicare Part D. So it's a big deal. It's going to be a big hit, and therefore the acronym, which stands for health insurance tax, and something to keep an eye on. It is absolutely going to have an impact on premium. The reinsurance assessment is supposed to be hit in 2014, and it is also going to be a pretty big deal. It also comes out for self-funded plans and stop-loss insurance policies. We have an exchange user fee, a sales tax, if you will, for plans sold in the federal exchange, 3.5% fee proposed right now. Expect to see that in the state exchanges as well, because remember, those state exchanges have to be self-sustaining by 2015. The money is going to have to come from somewhere. And of course, coming up in 2018, we've also got the Cadillac tax. You know, but we still only touched on some of the impacts as to why you're going to see rates change on your plans. This slide here really talks about what's going to happen that's significant for your insured group policies as they renew. As you look at the things up here, you see these are already in most plans. Most carriers in most states rate or discount for industry, employer size, current health status of the group, how long they've been on the books, what their claim status was last year, male, female, family size, tobacco, geographic region, and the age of the applicant. But in 2014, as your groups renew, or if a group buys a new plan, everything that I've crossed out here is no longer applicable. Now, depending on where you live, assuming you already have full-blown community rating, maybe this isn't a big deal to you. But these rating changes are expected to be significant in more than 45 states. So I expect most of you on this call have plans in your states that include discounts and loads for all of these factors. These changes will hit your groups as they renew on or after January 1st, 2014. We heard a lot of talk a few months ago about people changing their renewal date to, say, December 1st of 2013 to try to put all this off for a year. Saw something come out from the IRS a couple days ago that said, don't even try it. If they figure out that's what you're up to, they are going to come back down on you. So again, these changes are coming. I want to talk real briefly about the 3-to-1 age ratio. Again, currently 42 states have rate band restriction that's based on an age that is 5-to-1. So in that case, if a 24-year-old's health insurance premium is $1,200, the carrier could charge as much as $6,000 for a 60-year-old. On January 1, 2014, the health care law is going to limit that to 3-to-1. Now, we know that the reason that a 60-year-old's premium is more expensive than a 24-year-old is because they cost more. They use more insurance. So you're not going to see the rates drop by 30% on the older individuals. More likely, you're going to see the older individuals drop by about 10, which means in order to meet the 3-to-1 ratio, you're going to see the individual young guy, his premium jump probably 50%. Or in this example, his goes to $1,800, the older individual drops to $5,250. Now, this is a problem. This is a problem because we couldn't get these younger people to be insured when they were paying $1,200. And if we can't get them to pay $1,800 and fewer of them come out, the need to charge the older people even more is going to go up. So you're going to see some significant changes. Additionally, if you take into account everything we talked about on the previous screen, it is expected that the average case is going to see a 30% increase in overall premium on their renewal in January 2014. And the younger groups, those currently receiving industry or size discount, those that are healthy, those that are enjoying rates at the low end of the state rating bands, are going to see even more. I have seen as much as 85% as an estimated increase on a young, healthy, predominantly male group that's about 17 lives. So be cautious of this and be aware of it. You know, I reviewed this slide a couple weeks ago on our first webinar, and I know that many of you felt that my webinar was full of bad and worse news, and I'm sorry for that. I promise you, I'm not here to try to bring doom and gloom to your day. I just want you to know what's coming, because you need to be prepared, because you have got to be talking to your clients today about what's going to happen. Don't wait until they get a 60% renewal to try to have a conversation with them. So, you know, I want maybe me to take a step back for a minute and circle back to some things that we must talk about as we talk about the small group market. We need to talk about this new thing called an actuarial value requirement, and it has to do with something you've probably heard reference to called the metal plans. And that's because beginning with plan years starting in 2014, non-grandfathered plans sold in the exchanges are going to be required to have a minimum actuarial value. This is supposed to be a way for people to assess how a plan would benefit them in a given market. It's also a way that the government has decided to establish the minimum requirements for a plan to meet the mandate rule, and also for them to establish the amount of the subsidies. So it sounds easy, right? A 60% plan we would think would be covering 60% of the benefits, 60% of the cost of health care. It doesn't work quite that easy. The actuarial value is a measure of a level of protection that offers coverage for the essential health benefits covered under the plan based on an average population and an average plan as determined by each individual state in their exchange. Still some questions as to how the federal government is going to establish it for theirs, but they've actually got some assessments on that. Now, there are 4 levels of actuarial value in the PPACA regulations: bronze, silver, gold, and platinum. Bronze being the one at 60%. Now, an example of how this could work. If a state determines that an average person on the most popular plan sold in their small group market in that state would receive a benefit of at least 60% of the cost of their care for essential health benefits, the ones we talked about before, the plan would meet the criteria of being a bronze plan. Now, it's much more complicated than that, and we're expecting to see a quote-unquote simplified calculator provided to employers, and one that will be posted on all of the state and federal exchange websites. Right now, there is one out that's designed for carriers to use, so as they start to develop plans that they're going to be able to offer inside the exchanges and even outside the exchanges, they can begin to understand whether or not it meets the criteria. I've looked at the calculator. I know some of you have looked at the calculator, and the thing that I would say is that it's a good thing that it was designed for carriers, because I think very few people other than an actuary could figure it all out. The 2 things you need to know about this for now are that the plans inside the exchange will have to meet actuarial values based on these 4 criteria, that the individual subsidies will be based on the premium for the silver plans, while the mandates will be based on the bronze plans. So somebody could get a silver subsidy and use those monies towards a bronze plan and meet the requirement under the mandate. So if your eyes aren't glazed over yet, I don't think I'm doing a good enough job. I can't even imagine how hard this is for someone to understand. I'm going to be honest. I get confused sometimes when I'm going through this, and I've been studying it since before it was passed. The good news is that at Insurance Network, we have spent a ton of time training our teams. And these individuals work very hard to help their producers navigate all this. So if you're not already talking to one of our team, I really encourage you to reach out to them for guidance. And at the end of the webinar, I'm going to show you some tools that we've developed and also give you our number if you don't already have it. Because we're talking about small employer groups and things that impact them, I want to touch on summaries of benefit and coverage. Designed to be a critical component of the exchanges because they were designed to be a way that a plan could be easily kind of explained to make it similar to Expedia.com for health insurance. They had to have a format that would make it easy to understand. The problem is that they're very, very, very rigid templates. The other problem is not everybody is aware that if you have an HRA, an HSA, or an FSA, those plans either must be included in the SBC provided by your fully insured carrier, or if you're administering those on your own, they must have separate SBCs. So if you have, like we do in our office, we have an employer-funded HSA, when our plan renews next year, because we have a September 1st renewal, so we very briefly missed this cutoff. But on September 1st of 2012, we're going to have to provide all of our employees a separate SBC following this very specific template to show how the HSA will work for them on their plan. These, as I said, have been required since the first plan day of the first plan year on or after September 23rd, 2012, so beginning with your 10-1 renewals last year. As you have groups that are enrolling for new plans, these must be provided, and sometimes at cases or at time of initial proposal, but always provided at time of enrollment. I know here in our office, because of that, and because groups so often enroll for one plan and then make multiple changes to what they want by the time it gets out of underwriting, what we've started to do is when we receive your cases, we do a pre-screen on them first to try to get you rates before we do a formal enrollment. The reason we do that is so we don't confuse your groups by giving them multiple SBCs and try to get them to navigate all of that. One thing I want to point out here is that SBCs are also required for self-insured plans. So under fully insured plans, the fully insured carriers are doing a great job of getting these out for their employer groups. But on the self-funded side, if you have a group that's self-insured, you need to make sure that you're talking to the TPA to find out who's going to be responsible. Now again, with the carriers that we represent and the TPAs we represent here at INA, our vendors are absolutely providing these SBCs for you, but not all are. So make sure that you reach out. Now again, this is something we don't have time to go into in depth in today's call, but we've got some great resources available to help you if you need more information on SBCs. I'm going to recommend that you either reach out to our manager of our Employee Benefits Division, Mike Dibben, or any of his sales team for any of the items that we've discussed that you need more assistance on. Okay, so we are about 35 minutes in, and so I'm going to try to run through a few of these things pretty quickly. And I think on exchanges, I can run through this very fast because we went into this in pretty good detail in the last webinar. As a quick overview in case you missed that, here's a very simplistic view of the exchanges. Somebody is going to go to the exchange, whether they are a small employer group looking for coverage or an individual looking for coverage as well. They're going to fill out a pretty massive application in order to determine their eligibility for Medicaid, S-CHIP, the subsidies, and the out-of-pocket subsidies. So they're going to come in, they're going to fill out a lot of personal financial information. Last time I saw an estimate on the size of the application, believe it or not, 26 pages of information that somebody's going to have to complete. You might ask, why? Why so much stuff? Well, the reason for so much stuff is because behind the scenes, this exchange is going to have to be going out and talking to the IRS, Medicaid, the state, the feds, employers, and carriers. All of this is a huge IT undertaking, and I just don't know how it's going to be ready in September. Well, it's got to be ready and up and rolling October the 1st. That remains to be seen. Everybody thinks the feds will be ready. We'll see. You can see, just based on this real quick slide, what an IT nightmare it's going to be. One thing on here I want to talk about just real briefly as you look at it is tax credits, and we're going to talk about that more in just a minute. All right, one thing I wanted to cover with you, and honestly, I just didn't know where to put this slide so it would flow with the other information, are the rebates for small group fully insured plans. I thought it was important to cover it briefly because I don't want to assume that you know everything you need to know about what to do if one of your employer groups gets a rebate and calls you and says, hey, what do I do with this check I just got? But there are very real consequences for doing it wrong. A couple of highlights. In August of last year, they were paid out for the previous year. You'll see that happen again this year. They're based on the loss ratio of a geographic region. So even if a group has very high losses, they're going to receive a rebate if the other groups in that market performed quote-unquote well. And I say quote-unquote well because it doesn't necessarily mean that the carrier had a huge profit. It just means that because of the restrictions with MLR, that the carrier was forced to rebate a portion of the premium they received. I will tell you this, it can be a real disincentive to an insurer to find ways to cut claim costs. So it can be harmful as well as good. The average rebates we saw last year were 1% of premium in those states that got them. But the concern that we have here at Insurance Network is how difficult it can be for an employer to correctly allocate and manage the refunded premiums, because they have to properly handle them within 90 days of receipt. And there may be some pretty significant negative tax implications depending on how those premiums were received. In particular, if you have groups that are taking premiums out pre-tax through a Section 125 or a premium-only plan, and then they get the rebate and they use them, there may be tax consequences to the employees that received a rebate or had the premium withdrawn from their pay. The other thing that happened is that everybody under the plan, for example, in 2011, they all got a letter saying, hey, there was a rebate based on premium, even terminated employees. But the fact is that an employer didn't have to share that with the terminated employee if they weren't a participant in the plan last year. So that if they were on the plan in 2011, not in 2012, they got a letter, but they may not see any part of that rebate. So a lot of employers were getting phone calls from terminated employees who aren't always the happiest with that employer, asking for a share of money that they would not see a part of. Now again, this is an issue that we could probably spend 40 minutes. I was joking with my husband last night, and I said, I got to go in and I got to do in 45 minutes what would really take me about 8 hours to do a real good service for. So the thing I would tell you about this is I have looked extensively for resources, and believe it or not, I believe that one of the best resources for this is actually an FAQ released by the IRS last year. It walks you through numerous examples about how a rebate may or may not be used and whether or not it may or may not be taxed depending on the circumstances. I strongly recommend you get a copy of that FAQ and you get it out to every small employer you work with. If you need a copy of it, we have one for you here. And again, I'll give you a list of all these things that I recommend you call our office for at the end of the call. I'm going to try to swing through a couple more things because we are up at the 41-minute mark. Talk a bit about small business tax credit. Now, this is another topic that could take quite a bit of time, and it may not very well apply to any of your groups. I mean, it's pretty restrictive. You got to have 25 or fewer FTEs. They must have an average wage of under $50,000, and the sliding scale starts reducing beginning at 10 lives. So at 10 lives and 25,000, it's currently 35% of premium paid for those individuals can be taken as a tax credit. But the minute you hit 11 lives and $26,000 in wages, it starts to phase out until you get to 25 employees and $50,000, and it completely phases out at that point. Something you should be aware of is that in 2014, the tax credit increases to 50% of premium. But unlike today, where they could buy that plan from you on the open market and get the 35% credit, in 2014, they must purchase the plan inside the shop or the exchange in order to get the credit. If there's anything you should be talking to your representatives about right now, it's getting that changed. I don't see any reason why it can't stay outside of the exchange plans, since it is something that they file on their income taxes when they do their corporate taxes a year later. A couple of points to make here too. Excess premiums are still considered deductible. So if for some reason an employer is spending, I'm just going to use these round numbers, $10,000 for premium for a year, he qualifies for a 50% credit, $5,000 is going to come straight off the top of his tax bill. The other $5,000 would still be considered to be deductible. You remember earlier in this call when I told you that when it comes to calculating FTE calculations and determining a full-time versus all those things are different and the rules actually contradict themselves? Here's another example of that. I showed you the people that you exclude for determining an FTE when it comes to determining group size for employer responsibility. But in the small business tax credit, you also exclude family members of owners, both when counting hours and determining average wages. And honestly, I think this is a good thing, because when you start taking out family members of owners and their wages, oftentimes those are the people who drive the wages up because they're the more highly compensated employees. So you need to know that, because you may be telling some of your groups they're not eligible because their wages are too high, but if you take the owners and their family members out, there may be a difference. We do have a small business tax credit calculator that we brought out back when it was 35% of premium. We have updated that to show you what the credits are in 2014. And again, while this may not apply to any of your groups, wouldn't you like a reason to call on new prospects that perhaps no one else is talking to them about? In other words, something that it actually could benefit them? So this is something that I would strongly recommend that you consider doing a call out to on any groups that you know have 25 or fewer employees. Now, while you're out there talking to your clients and prospects about the tax credits and the changes that are coming their way, you may need to be talking to them about self-funding. It's not for everyone, but today's self-funded plans are much more employer-friendly and easier to administer and sell in the small group market than the plans you probably saw 10 years ago for the same size groups. Inside self-funding, there are less punitive non-discrimination rules. And even though we're running short on time, I'm going to hope you'll forgive me for just giving you an example of what I mean by that. Now, you should know that temporarily this rule is on hold. It was supposed to go into effect in September of 2010. A lot of pushback, a lot of questions, and so it's temporarily on hold. But the IRS has said they do expect to come back out with this rule, and I want to give you an example of what this means. In our office at Insurance Network, we've got a pretty good employee benefit plan. We pay 90% of our employees' premium on their own, self-only coverage, 50% of the dependent premium, and we have a significant contribution to a health savings account for all employees who participate. We have a 30-day waiting period, and our employees are eligible for all of those benefits on the first calendar day following 30 days of full-time employment. Let me show you how that can be a good, bad thing. About 3 years ago, we stole away our employee benefits division, Mike Dibben. Now, Mike Dibben was working for a large company, and we wanted him. And so we went and we brought Mike on staff. Now, he didn't do this, but let's just say Mike had come to us and said, you know, guys, I'd love to come work for you, but this 30-day waiting period that you have for your employees, I need my coverage immediately. Now, today on a fully insured plan, I could do that. As long as the carrier allows me to offer him coverage and waive the waiting period, I could do that. Under the non-discrimination rules for fully insured plans under PPACA, I would be discriminating against our other 25 employees. because I didn't offer them a 0-day waiting period. And this is how that works. We would have to pay an excise penalty of $100 per day for every day we discriminated, for every employee we discriminated against. So we have 25 employees who had to wait 30 days for their benefits, so we discriminated against 25 people. That's $2,500 a day for the 30 days we discriminated against them. Can you see how that would add up very, very quickly? Now, on a self-funding plan, there are also non-discrimination rules, but here's the difference. Instead of us having to pay $2,500 times 30 days in an excise penalty, we would simply go to Mike and say, we'd be happy to waive your waiting period, but that period of time when it would be a discriminatory benefit, you're going to have to pay wages on that benefit. So Mike ends up paying a little bit more in taxes, we pay a little bit more in employment taxes, we all move on, significantly different. And I think one of the most punitive things in PPACA is taking away a small employer's ability to negotiate with key employees when they go to recruit them. Another thing about self-funding versus fully insured, less hassle with those rebates without having to give up the chance for money back. More flexibility in plan design, fewer taxes and fees. And those that will be hit the hardest for premium increases in 2014, those young, healthy groups, may be the best candidates. Now, you're probably hearing a lot of pushback from some of the larger fully insured carriers and from some of the exchange administrators saying that this is going to be the reason everybody leaves fully insured, goes to self-funding, and we're going to have massive problems with adverse selection. So understand that there's a little private war going on in the background. I suggest you talk to your representatives and you talk to them about these first five bullets instead, because I don't think there's going to be as much adverse selection as you think. I think you're going to see a lot of people take self-funding as an option because they like the ability to still manage a plan that meets their needs. The last bullet here is absolutely the truth. One of the things about self-funding versus fully insured is that the compensation you receive in self-funding is between you and your client, not you and the government. And I say not you and the government versus not you and the carrier for a reason. Carriers that are cutting back your comp, most of them didn't want to. It was the minimum loss ratio requirements that forced their hands. So when you sell a self-funded plan, you have the ability to set the compensation at the level you're earning with that client. And I know you're doing such a great job for them, they're not going to mind compensating you for your time. So I'm going to wrap this up pretty quickly with some recommended strategies, and then we'll see if we've still got time for some questions. Get out to your clients. Now is the time. Don't wait until your clients get a 60% renewal to talk to them about what's coming. And to help you, we've developed numerous tools that you can use across the desk from your clients, or as a prospecting piece you can send out. Volunteer to talk to civic groups in the chamber. They're looking at this crystal ball, wondering what the heck it all means, and you have the answers. Be a resource today, and you will secure your business for the future. Because the truth is we're resilient. We've faced other storms. We've survived other threats. This will most likely be the most challenging yet. And while we can't predict the exact outcome of it all, with the right attitude and the right partners, we can definitely transform our practices. And together, we can do this. Show you a couple pieces we've created to help you. This particular piece, as you can see from the bottom, you can put your agent information on it, your phone number, your email address, whatever information you want. This is the one that talks about the effects of community rating. And you notice at the very bottom we talk about calling you to discuss strategies to help prevent or alleviate the increase. I recommend that you ask us for a copy of this piece. No obligation to you. You call us, talk to one of our employee benefit specialists. They'll gladly get this out to you. Another piece we put together for you was a flow chart as it relates to the employer penalties. Now, I know we didn't talk a lot about the penalties. We'll do that next week, but I did want to show you this piece. This piece is a clear flow chart of not only do you have to be subject to a penalty, but if you are, as an employer, what would the penalty be? This one can also be modified. It doesn't show it on here, but ask us, and we can get your name and information on this one as well. I think this is a great piece to sit across the desk of an employer and walk him through whether or not he has to deal with a penalty. This particular piece we created for the individual market. This is if you're sitting and talking to somebody on the individual side about whether or not they're subject to the insurance mandates. It talks about the people that are excluded from the mandate, those that have a religion opposed and other types of reasons, including being in jail, or family income being below a threshold, or the amount of premium it would cost you. In other words, it's unaffordable. Also talks about some of the different types of plans that meet the criteria, and this has been a huge question, and I know we talked about it on our last webinar. It's still been getting a lot of questions about this. These are the plans: TRICARE, Medicare, Medicaid, VA, an employer plan, and there is no current definition of what that employer plan has to cover. If you say, yes, I have an employer plan, even if it doesn't meet the bronze standard, right now, you don't have to worry about it. You meet the requirement for health insurance. If you buy insurance on your own, it has to be at least at the bronze level, unless it was a grandfathered plan in existence before the health reform law was enacted. And then there are the information on the penalties. Again, this is a piece we've created for you, no obligation. We just wanted to help you get something in front of your clients because we know you're getting these questions. This particular piece we created for you walks an employer through some of the performance differences between a self-funded plan or an alternate funded plan versus a fully insured plan and the costs associated. And you can see really quickly here that a alternate funded plan cost per employee, based on a pretty good survey over 4 years, independent, not us, shows that there are significant reasons to be talking about self-funding. This also gives the employer some questions to ask and ask them to call you for a no-obligation review. So those are some of the tools we have. We have lots more. These are the things we talked about, and our phone number. The individual mandate tool, employer penalty tool. We do have a small business tax credit calculator. It's an Excel document. It walks you through those small groups, knowing whether or not they would be eligible for a tax credit, and if so, how much. Again, we have found not a lot of groups qualify because of the restrictions on wage and or number of employees. It's the wage that kicks them out more often than anything. But it's a great conversation starter for you to get in front of your client and say, by the way, I need to talk to you about these other things that are coming. Do not wait until they get a huge renewal. That is not the time to try to have a conversation with them about options. The community rating prospecting piece is going to explain to them why they're going to see a significant change in 2014. And hey, they may see a good change. I've actually seen estimates where some groups, older groups, sicker groups, smaller groups, might see as much as a 70% decrease in premium. They're still going to need to know why that is so they don't think that we've just been overcharging them substantially for years. The alternate funded rating piece I just showed you. We've got the FAQ on the rebates, what to do with them if you're an employer, and the 4 fees. Also want to make sure that you sign up for our next session, which will be coming up on March 21st at 10 o'clock, and we're going to really talk about the pay-or-play mandate, the employer responsibility rules in that one. That should be the easiest of all the ones we've been talking about so far, and so hopefully that'll benefit you. I've got a team of people ready to take your calls right now if you want to give us a call. I am going to, for those of you willing to hang out with me for just a couple minutes, and I know we're up against the hour mark, I'm just going to see if there are a couple of questions I can take. And then at the conclusion of the questions, what I will do is, if we couldn't get to them, then we will, sorry, just got to bring that baby out. What we'll do if we can't get to them is we'll have staff reach out to you and try to answer them, because I do see I have a lot of questions. Okay, under the controlled group, would you apply that to franchise companies such as McDonald's, Subway, etc.? Mike, the answer to that, based on what I've seen, is actually yes. How do we make money with this program? I'm not sure which program you mean, Kyle, so reach out to our office. Again, we're not selling any programs here. We're just trying to provide good information to you and hoping that we are doing so. Need to verify that leased employees are included in the count for FTE. That is not true. If you're a PEO and you have leased employees and they are the ones, you are the one that is submitting the W-2 for them, then you would be the one that has to count them. But if you are a member group of a PEO, in other words, all of your employees are leased through that PEO, you would not count them. Common ownership, how is it to be determined? There is a specific definition for controlled groups that I can get out to you. Does the out-of-pocket limitation include the deductible? Yes, it includes the in-network deductible. What constitutes fully insured plans? Fully insured plans would be the typical plans you see now. I mean, you're normal, you're going to pay the premium every single month, and if it was a great year and you had great claims, the carrier is going to keep the premium, not give you any back other than the rebates. If it was a really lousy year, they're going to keep all the premium. So just your typical fully insured plan. Let me see. Okay, somebody's asking for the information on the IRS statement regarding switching to a December renewal. Jennifer, I will find that for you and ship that out to you. I see, Christina, you're saying the same thing, that most of some of the carriers were renewing their plans back in 2012, trying to, avoid some of this mandate. That may or may not work. We'll have to take a look at some of that. Okay, we are right up against the hour mark, and boy, I've got a lot of I have a lot of questions still to get to. I'm going to ask our staff to reach out to you guys on those questions, and I'm sorry I couldn't get to them. We will be, well, in fact, we did record this session, so it will be on our website by the end of the week. So please reach out to us if we can be of any assistance to you. And again, we've got a staff hanging out waiting to answer any questions that we didn't get to. Please reach out to us and let us be of assistance. We are in this together. So let's get through this together. And again, I appreciate your time today.